Can alternative therapies improve sexual life? Why do some women lose interest in sex during menopause? Hello to all lovers of psychology and sexuality. Today, we will unveil the sexual curiosities of women. If you are interested in these topics, make sure to subscribe and activate the notification bell to not miss our future videos. Also, leave us comments and share your experiences in the section below. Let's get started. Some alternative therapies, such as acupuncture or massage therapy, may benefit sexual life by reducing stress and enhancing relaxation. However, it's important to consult a healthcare professional before trying these therapies. During menopause, hormone levels, such as estrogen, can decrease, leading to changes in vaginal lubrication and sexual desire. Hot flashes and other symptoms can affect interest in sex. However, many women can maintain a satisfying sex life with the help of appropriate therapies and treatments. The influence of the moon. Some people believe that the moon's phase can influence libido and sexual behavior. Although lacking solid scientific evidence, this belief persists in some cultures. Sexual inhibitors. Some medications can have sexual side effects. Sexual inhibitors, such as some antidepressants, may reduce sexual desire or make arousal and orgasm more difficult. It is important to talk to a healthcare professional if experiencing these effects. Carezza is an approach to sexual intimacy that focuses on emotional connection and mindfulness rather than orgasm. This practice promotes prolonged and deep sexual relationships, based on the idea that controlling arousal can strengthen the connection between partners. Masturbation in the Bible. Although masturbation has often been viewed as taboo in some cultures, the Bible does not explicitly mention masturbation. Interpretations vary. Men in relationships tend to masturbate more than singles. This is because regular sexual activity can increase testosterone levels, thereby boosting sexual desire. This cycle is an interesting phenomenon that illustrates the relationship between sexual activity and body chemistry. The myth of the erogenous zone. The human body is full of erogenous zones, touch-sensitive areas that can be highly pleasurable when stimulated. These zones vary among individuals. Multiple orgasms. Some women can experience multiple orgasms in a single sexual session. This means they can reach climax several times in a short period without the need for a refractory period, which is common in men. Non-verbal communication. The ability to communicate through gestures, eye contact, and positive body language can be very attractive. Orgasm without ejaculation. Similar to women, men can experience orgasms without ejaculation, an experience known as dry orgasm. This can occur for various reasons, such as practicing semen retention. Female orgasm and the clitoris. The clitoris is a highly sensitive organ that plays a central role in the female orgasm. Direct stimulation of the clitoris is key for many women to achieve orgasm. Paraphilias are patterns of atypical sexual attraction. Some examples include object fetishization, voyeurism, watching others have sex, and BDSM, bondage, discipline, domination, submission, sadism, and masochism. Paraphilias can be harmless as long as they are practiced consensually and safely. Personal care, including hygiene, style, and health, can also influence attraction. Point A. Similar to the G-spot, some women report the existence of an A-spot on the anterior wall of the rectum, which can be stimulated to induce intense orgasms. Post-orgasm, sensitivity. After an orgasm, some women may experience increased sensitivity in erogenous zones, making them more responsive to additional stimulation. Prostate orgasm. Prostate stimulation can lead to intense orgasms in men, often achieved through anal stimulation, known as the prostate orgasm. Psychological effects. Orgasms release various chemicals in the brain, including dopamine and oxytocin, which can have powerful effects on emotions and the connection between sexual partners. Sleep and sex are interconnected. Having sex before bedtime can help release tensions and promote more restful sleep. Additionally, some people experience erotic dreams that can result in sexual arousal during the night. Polysexual relationships. Some individuals identify as polysexual, meaning they can feel sexual attraction to individuals of various genders, regardless of whether they identify as men, women, or any other gender identity. Risks and injury prevention. Lack of adequate lubrication, rough penetration, or the use of inappropriate objects can increase the risk of injuries. Taking precautions is essential to avoid problems. Sense of responsibility. The ability to take on responsibilities and commitments in life, whether at work, in a relationship, or in the community, is valued. Sex in the Middle Ages. During the Middle Ages, sexuality was influenced by religious morality and a lack of sexual education. However, erotic manuals and sexual practices also existed. Virtual sex. With the advancement of technology, virtual sex has become more common. Couples can maintain intimacy over long distances through video chats and other technological tools. Sex and pregnancy. Having sexual relations during pregnancy is generally safe, unless otherwise indicated by a doctor. In fact, many couples find that their sex life improves during this period. Sex and heart health. Regular sex can be beneficial for heart health. It has been shown that regular sexual activity reduces the risk of cardiovascular disease. Simulated orgasm. While not exclusive to women, some may simulate an orgasm for various reasons, such as satisfying their partner or ending sexual activity. Open communication and intimacy in a relationship can help prevent this. Spirituality. For some women, spirituality and the search for meaning in life are attractive qualities. Breast size and desire. Studies have shown that there is no significant correlation between a woman's breast size and her ability to arouse sexual desire in others. Attractiveness is subjective and varies from person to person. Toys designed for anal sex. There are sex toys specifically designed for anal sex, with shapes and features that maximize pleasure and minimize the risk of injuries. Vaginal orgasm versus clitoral orgasm. While clitoral stimulation is a common source of female orgasms, some women may experience vaginal orgasms from stimulation of the anterior vaginal wall, known as the G-spot. Speed of arousal. Men can have a complete erection in just 10 seconds, and sometimes they only need to look at something that stimulates them for a few seconds. In contrast, women require stimuli more related to the brain, such as emotional intimacy and connection. Vibration and therapy. Vibrations are used in sexual therapy to treat issues such as erectile dysfunction and anorgasmia. Vibrating sex toys can be effective tools in therapy. Human sexuality is a fascinating and diverse field that never ceases to amaze us. Sexual curiosities unveil the wonderful complexity of the human experience in the intimate realm. As we explore and understand these facts, it is crucial to remember that each individual is unique in their sexual experience. Respecting and communicating with your partner are the keys to a satisfying and healthy sexual life. Sexual education and understanding are essential tools for fully embracing our sexuality.